Drink it every morning like water. It will clear up your clogged blood vessels. The blood vessels of our people are in a very dangerous state. The blood vessels are narrowing. There are problems, because I am taking medicine without thinking about how to treat it fundamentally, so I think I am being treated. I hope you don't get it wrong. It's a condition where your blood vessels improve and your blood pressure drops without needing blood pressure medication by changing your lifestyle habits. Then, the blood vessel condition will be normal if the insulin in my body functions normally without diabetes medication. You need to think about fundamental treatments that can improve and prevent chronic diseases such as cancer. So the way to get out is one day it can be said that the health of the blood vessels is the cause of all diseases. It is important to think about the representative metabolic diseases such as hypertension, diabetes, and hyperlipidemia, and the blood vessels gradually become narrower or inflamed. The fundamental cause of hypertension is that the blood pressure in the central arm increases as the very small blood vessels accumulate and become unhealthy. Diabetes is the same. It is a sticky state where sugar keeps floating around in the blood and keeps clogging the blood vessels. If you look at diabetic complications, they are all vascular problems. The first thing that comes with diabetic complications is where is it? Diabetic retinopathy occurs when the retina, where the tiny blood vessels are gathered, is damaged, whether it is the eyes or kidneys. In the case of the kidney, the glomeruli become inflamed and blocked or cannot pass through, causing the glomeruli to break and become blocked. These problems combine to form diabetic nephropathy, and in cases like hyperlipidemia, the process of chronic diseases occurs. It is a disease where fat floats around in the blood vessels, causing inflammation and causing myocardial infarction. Angina occurs, and cerebral infarction occurs due to blockage of cerebral blood vessels, and furthermore, when you go to China, oxygen is supplied to the ends of the tissues. If they are unable to send oxygen, the metabolic state of the cells becomes hypoxic and acidic. As the body temperature decreases and the temperature increases, the state of the genome changes and division continues. It's cancer. Cancer is not something you get because you're unlucky. There are blood vessels in front of all the metabolic quality sky. I keep telling you how important it is to keep the blood vessels in our body clean and in a normal state. Even if it's not a blood clot, there are problems that cause our blood vessels to narrow, like hyperlipidemia, which is complete inflammation. As it gets worse, the blood vessels become narrower and narrower, so this condition actually appears as high blood pressure. But we think of high blood pressure as something very funny. High blood pressure in people in their 30s is also increasing, and it is now over 15% of the total population. There are statistics to show that the blood vessels of the people of Urinara are in a very dangerous state. It is fundamentally necessary to treat them. I hope you don't make the mistake of thinking that I'm being cured because I'm taking medicine without thinking about the method. It's like using drugs to forcibly lower blood pressure to prevent blood vessels from bursting or small blood vessels from becoming suddenly blocked. It is not a fundamental treatment. You have to try various drugs to lower blood sugar levels. But in the end, there is no fundamental solution. Since it does not solve the insulin resistance condition, it improves the vascular system without blood pressure medication by changing lifestyle habits. A state where blood pressure is lowered, and then insulin in my body functions normally without diabetes medication, and blood sugar is transferred to muscle cells. The blood vessel condition will improve only when it is put in and returns to normal, and chronic diseases such as cancer will improve. You need to think about a fundamental treatment that can prevent things like blood clots. It means that when a blood clot forms and clumps together, it suddenly travels through the bloodstream and appears in each part of the body. It can block very small blood vessels. When very small blood vessels are blocked, we don't notice anything and it just passes, but it can cause something called vascular dementia. There are cases where it can cause blood clots, so it is very important to avoid creating a condition where blood clots can form. Vegetables and fruits are foods that help with vascular health. Among them, vegetables are the main focus, but modern people eat vegetables and scissors. If you tell them to eat a lot, this is not an easy problem. So the solution is to drink a glass of good juice a day. This method is called juice. I am not talking about juice that is sold outside and contains a lot of liquid fructose. I'm talking about juice that's been made. There's a lot of talk about things like ABC juice. The important thing here is that the juice is squeezed, so the juice that is squeezed at home is not very useful because it contains a lot of fiber. If you have difficulty eating apples, beets, and carrots by grinding them, you can mix in some tropical fruits. Or, you can add a little water to lower the density a little and increase the amount to drink it that way. Because it has too much fiber and comes out dry, if you grind only 3, in my case, when I eat it at home, I use ACC, but apples are delicious. Add apples, carrots, and then cabbage. Then mix in 1 or 2 tropical fruits. Add blueberries and other ingredients to increase the flavor a little, add a glass of water, and grind it like this. It's a mixture of live vegetables and wheat. It's a great way to get all the antioxidants, fiber, and vitamins from fruits, of course, by chewing them thoroughly. It would be nice if I could eat them all individually, but there is a limit to how much I can eat them. They are also too hard, especially in the case of carrots. It is very difficult to tell people to chew them thoroughly and eat a lot. That is why carrots are not left out here. Carrots are famous for containing a lot of vitamin A, so they are the best way to consume vitamin A. Carrots are not missing, so if you want to include fat, I recommend adding good fat from avocado. I want to eat good fats. It is very important to eat healthy fats when it comes to fats, polyunsaturated fats, trans fats. Fat can be divided like this. Among unsaturated fats, it contains a lot of omega-3, which helps reduce inflammation. It is good to eat a lot of fats that increase HDL and reduce LDL, such as avocados. If you eat meat, try sardines if possible. The second most important thing is that you can eat relatively high fats such as mackerel, which is high in omega-3. We can talk about fiber, but it is not a substance that is directly absorbed by our body. Fiber is a substance that is in the intestines. It remains as is, but the remaining fiber can become food for lactic acid bacteria, or a home for lactic acid bacteria. Fat and other things also play a role in absorbing and sending down things that our body does not need to absorb. It also plays a role in capturing and expelling toxic substances, preventing long-term stool damage, and preventing the intestines from becoming contaminated. When we talk about fiber, we are talking about soluble fiber and coarse fiber, which are dissolved in liquid. The fibers play an important role during the process of action, but the coarse fibers contained in the shell and such are extremely important. If possible, eat fruits with the skin on, and eat whole grains such as oats, quinoa, and brown rice to improve digestion. It is very important to take care of your health. The next thing I want to talk about is foods rich in antioxidants. Foods' antioxidants are known to be found in large quantities in vegetables and fruits. I especially recommend eating a lot of green vegetables, including spinach, kale, broccoli, and lettuce. The more you eat three-dimensional cows, the better. I tell you that you should eat about 6 or 7 pieces per meal. Berries are also known to contain a lot of antioxidants. In my case, I often eat frozen blueberries with my children. It is known that the antioxidant effect increases when frozen or eaten cold, so frozen berries are also enjoyed a lot. I would like to give you the most important substance, which is an indispensable substance in healthy fat. We can talk about omega-3 fatty acids. Among the unsaturated fatty acids, omega-6, 9, and 3. In particular, they say that it is good because it has an anti-inflammatory effect, especially if it contains a lot of omega-3 fatty acids. Eat fats high in omega-3 fatty acids because they have the effect of raising HDL and lowering LDL. Then it is a type of vitamin, and among them, I will talk about vitamin 2 and vitamin C, which have particularly strong antioxidant effects. Since vegetables are rich in many of the most famous substances that have antioxidant effects, eat a lot of them and take vitamins. In cases like C, there are also cheap medicines available, so I recommend taking them together. The third is polyphenol, which are found in dark chocolate and berries. It is said to have an important effect on blood vessel tourism. In addition, it contains allicin, which is found in garlic and onions. There are effects of spicy substances, and those are also very helpful, and the quercetin antioxidant in onions is very helpful. It is said to play a role, and then there are minerals that help relax blood vessels, such as magnesium. I can talk about potassium. It acts as a resistor to sodium and lowers the lead level, so potassium is for famous things. We can now talk about fruits like bananas, and as for magnesium, we can now talk about nuts, or we talk a lot about these eating habits that are bad for your blood vessels. The screen is typically full of excess fat or excess carbohydrates, leaving behind carbohydrates. If there are calories, they are stored as glycogen in the liver, but if they cannot be stored properly, they eventually turn into fat and accumulate in fat cells. The volume of blood vessels must be expanded accordingly. If the volume is increased, what should be done to supply oxygen to the end? In order to send it again, the blood vessels must continue to expand. In order to increase the pressure in the blood vessels must expand. You have to increase it. That's why high blood pressure, diabetes, and high cholesterol are all related to fat and excessive carbohydrates. I'm telling you that you need to limit it because excessive fat plays that role. And then you have a lot of calories and vitamins. I'm telling you that you should avoid foods that don't have mineral fiber. You should avoid rice bread and noodles. And then we should avoid convenience store food and processed foods. They contain a lot of vitamins, minerals, and fiber. At the cell level, there are substances that can properly operate the TC cycle, which allows mitochondria to function normally. It all goes into our bodies. I can tell you that diet has a huge impact on vascular health. Secondly, lack of exercise is now also a major cause. Exercise is something that speeds up the blood flow in the body. It is a process that increases the heart rate, metabolizes energy, and raises body temperature. Exercise is a part of our daily life these days. There are many cases where it is very lacking. For example, you never go outside, or you sit at your desk and send out papers all day, or you only have tea. There may be times when you don't have the opportunity to get your blood flowing quickly, such as when you're riding a bike. So, make time to sweat once in a while. You need to give it, or you need to create such an opportunity in your life. Right after that, you have to go up and down the stairs. Thirdly, smoking is a very important factor. Smoking causes harmful substances, and malignant these substances have a very bad effect on blood vessels, so they should be avoided, especially for blood vessel health. Then, excessive drinking will also have an effect. Alcohol is an addictive substance that contains a lot of excessive calories. It's a substance that contains alcohol and sugar. When you drink a very small amount, it circulates through your bloodstream. There's some effect from exercise that makes you turn quickly, but if you drink more than one glass, the negative effects become greater from the second glass. That's why alcohol is one of the things you should avoid, and the next most important thing is stress and sleep. You may wonder what the importance of stress and sleep is in maintaining vascular health, but that is not the case. One of the most important things that relaxes and constricts blood vessels is the sympathetic and parasympathetic nerves. Yes, if you are tense all day and in that state, your blood vessels stay in a narrowed state for a long time, and in that state, it is said that vascular diseases are more prevalent, and that even if you are in a state of tension, you should take time to relax in between. You need time to let go, time to take deep breaths, time to meditate, and especially time to sleep deeply and comfortably. That's why I'm telling you that it's important for the vascular wilderness. Another important thing is obesity. Fat, if it accumulates in the body, it can cause abdominal obesity, obesity around the internal organs, and excess fat cells. When too much is accumulated, blood vessels that were not there before are created to send nutrients and immune substances to the enlarged fat cells. They have to keep growing, so as the blood vessels grow, the central blood pressure rises to send pressure to distant blood vessels. This is also a cause of high blood pressure. In order to maintain vascular health, it is important to reduce obesity. Reducing it is one of the important factors for vascular health. You have to control your eating habits and exercise. Ultimately, it goes back to the fundamental question. Today, we will discuss good things for vascular health. I've talked about many lifestyle habits, but if I had to pick just one, the most important one, I'd say exercise. I think I should give it to you because it is one of the good habits for vascular health that can quickly circulate blood. There is nothing like exercise. I think we spend a lot of time thinking that we exercise on purpose. I want to talk about exercise. If you want to exercise regularly, you have to make time for it and make it a habit. It's good to go to the gym and do strength training, but I'd like to talk about aerobic exercise. If you do aerobic exercise, now is the time. The first thing that comes to mind is probably a treadmill, but running on a machine is a good way to do it, but there are also other ways to do it nearby. Let's use the exercise equipment we have. Do things like stair climbing, squats, and mountain climbers in my room. Okay, one of the good upper body strength exercises is the plank exercise, but now the plank position it's actually hard to maintain for a long time, so I'll lower the intensity a bit and do a plank on a chair and then do that. I recommend doing this exercise 3 times for 1 minute each, with the mountain climber leg raises in the same position. I watched the video. Let's choose one exercise and live our lives. Everyone has fatty liver. Instead of breakfast, eat a spoonful of this and sticky fatty liver will disappear. It is not something to be laughed at like this. Where among modern people is there anyone who does not have fatty liver? Fatty liver is fat in the liver. It is said that it is accumulated and then leads to fatty liver, alcoholic hepatitis, and then cirrhosis. It is a liver that delays cirrhosis. As it hardens, it can no longer function as a liver and hardens, and ascites and various complications occur. The incidence of liver cancer also increases, and bad diseases occur in sequence. To improve metabolism, eat foods that are not excessively high in carbohydrates, fats, or proteins. You have to eat a lot of those kinds of foods. Fatty liver disease is becoming very common in modern people. What kind of organ is the liver? If you think about it first, you will understand why this happens. The liver is a representative detoxification organ. Carbohydrates, when you eat protein, fat, minerals, and such, those substances are absorbed into the blood. It gathers in the liver and goes through a metabolic process, so the metabolism is either insufficient or excessive. When it comes to liver problems, if you look at videos of Africa, you see people with big bellies and thin arms and legs. You know, in some cases, it's a condition where ascites builds up due to some albumin disease. This is a problem that arises from lack of energy and lack of absorption. In reality, such cases are rare in our country. It's gone, and now the liver is filled with too much energy and can't maintain it, etc. Problems arise when you eat foods such as whole grains that are derived from nature. For example, when you eat these foods, your blood sugar level rises slowly. It should be like this, when it goes up and is consumed and disappears, but it is not like that, and there are many processed foods containing wheat flour. When you eat, the remaining energy is stored in the liver as glycogen. It raises blood sugar, and if it doesn't, it is stored as glycogen. Energy is stored in the liver, and even if it is stored that way, the remaining substances eventually turn into fat. Then, fat accumulates in various parts of our body. Fatty liver disease is caused by this in fat cells. It happens that complications due to fatty liver disease occur. In addition, there is another thing that affects the liver in our lives. There is one major factor. It is a very famous toxic substance, alcohol. When we look at alcohol, we see that it contains sugar. There are calories in it, and you are drinking real sugar with almost no other substances. Some of them are alcoholic and will heat up the body and turn red, but other substances will be eliminated from the liver. It is a burden and useless process to change acetaldehyde into acetic acid while giving a lot of energy. Energy is left in the body, causing inflammation, glycogen buildup in the liver, and fat storage. As the process progresses, it creates microscopic inflammation in the liver and too much sugar enters our body. It's a strain in any situation, and our modern people's eating habits are exactly like that. We eat out and eat rice. How many of us have the habit of eating noodles as our main meal, eating a lot of simple sugar, eating quickly, and not eating vegetables? We need to know what is causing the burden and change it. It can be said that the health of modern patients is under great threat. Fatty liver disease means that fat has accumulated in the liver. If the fat ratio exceeds 5%, it is now called fat. It is expressed like this, but it can be determined with a CT or ultrasound, but it can also be determined to some extent with liver function tests. If it goes beyond fatty liver disease and goes up to 40, it goes beyond fatty liver disease and goes up to hepatitis. You have to make a judgment like this, and if it goes beyond that level, it can lead to cirrhosis, or even liver cancer. Even diseases can occur, so when you have fatty liver, the liver function test results do not increase yet, and only fat accumulates. Since you are in that state, if you fast and reduce the burden of fat on the liver, then you can get it back. If you are in a sufficient state and you go beyond that, you may reach a state of no return, so it is a habit to develop in a state of fatty liver or hepatitis. You need to change it to foods that are not only rich in carbohydrates, fats, and proteins, but also rich in vitamins, minerals, and fiber. You should eat a lot of foods that are rich in antioxidants. They only contain carbohydrates, fat, and protein, so they only contain calories. The biggest problem is eating too much of many foods. But first, you have to eat good foods. You have to eat natural ingredients. Even when you eat rice, it is processed outside and all the vitamins and minerals are removed. It is better to eat brown rice instead of white rice, and then cook vegetables to get vitamin C. Eat only raw green vegetables, not vegetables that have been washed in water, and do not leave out seaweed and other foods. Even if you eat well and eat meat, you should not eat it by burning it, grilling it like this, cooking it at too high a temperature, frying it, or like this. It is recommended to eat it without cooking it at excessive temperatures by steaming or boiling it. The second way is to empty your stomach. Fasting. Eat excessively until you are full. Don't chew. If we eat without doing this, we will end up in an environment where we have no choice but to eat excessive calories. After we eat food, that's it. It takes at least 20 minutes after eating to feel full. You need to chew and swallow food slowly and put the broken down food into your digestive system. It is broken down, digested, and absorbed well, but the time it takes to eat it is longer. Eat it quickly and diligently in 10 minutes. When you eat, you have to eat more to feel full. Oh, there's something like that in an experiment. Let's say we put soup in a bowl. The theory is that if you keep feeding people soup from below, they will eat more because I can see it with my eyes. Because it is effective, you feel like you have to eat all of it, so you end up eating a lot, but if the bowl is small, when the soup is no longer supplied, it is time to feel full, even though you only ate a little, because you ate it all with your eyes. This is how you think, so you put a small amount on the plate and then slowly eat it all and empty the plate. Accept the feeling and eat less by making the bowl smaller. So eat good food, fast, and eat slowly. The third way is to have a period of deliberate fasting. It is called intermittent fasting. It is a method of taking a break from time to time. It gives time. In the case of alcohol, it is better to take a break for a few days and drink it than to drink it every day. It reduces the burden. In the same way, food also puts a burden on the liver. So it gives the liver a break for a certain amount of time. It is very helpful to eat for about 8 hours a day and rest for 16 hours. I'm talking like this, but there's a part that's a bit difficult to keep from the beginning. The method is to skip one meal during the day. I think it's a really good idea. In my case, I do intermittent fasting by skipping breakfast whenever possible. If you use it, you eat lunch at 12 o'clock and dinner at 6 o'clock. Then, from 12 o'clock, you eat the time it takes to digest. If you add up the time, it's about 8 hours until 7 o'clock, and after that, from dinner to morning, I don't eat. It's normal to eat breakfast. If that's difficult, you can start by fasting for 12 hours. You can work a little late and have dinner a little early, so you can rest from 6 to 8 or from 8 to 8. If you set a time for fasting, your liver can rest, but one of the biggest reasons you can't do it is the typical problem is nighttime eating, which causes a vicious cycle. If you eat one more meal at night, you end up eating 4 meals. Not only does it leave your liver no time to rest, it also has the effect of consuming excessive calories and leaving undigested food in your body. It is recommended to prohibit eating at night because you may feel like you are sleeping in a state of indigestion or you may experience this type of behavior. That would be great, and if possible, I would suggest that you consider skipping breakfast once every few days. I want to do intermittent fasting consistently. The first thing I do is to remove excess fat from my body. It has the effect of restoring to normal the accumulation of glycogen, liver inflammation, or fatty liver. When these substances accumulate in the liver, there must be time to release them into the bloodstream as blood sugar levels drop. For example, we eat snacks like this. We eat breakfast, eat snacks, eat lunch, eat snacks, eat dinner. If we continue to feed our bodies like this every 2 or 3 hours after eating a snack, the remaining blood sugar will be sent to be used up. There has to be time, but that time disappears, and the liver continues to be burdened with storing the remaining calories. It leads to obesity because the remaining calories are stored as fat, and you don't snack between meals. Then, by fasting breakfast, you have time to empty your liver, which will reduce obesity and high blood pressure. It also has a special effect on diabetic hyperlipidemia. Intermittent fasting is not only good for liver health, but also for cancer. I think it has a good effect that even prevents it. If you want to improve your metabolism by eating carbohydrates and fats, instead of eating foods that are excessively high in protein, eat foods that are rich in vitamins, minerals, and fiber. The answer is to avoid processed foods that contain a lot of simple sugars, such as bread, rice cakes, and noodles. The second is that the excessive acidity in beverages and other fructose-containing foods are absorbed too quickly. Sugar is the problem, and in the case of fat, you need to eat foods that contain a lot of good fat. So unsaturated fat, it would be good to know which fats are representative of those that contain a lot of omega-3 among vegetable fats. The most representative substance in our country that contains a lot of 3 is wild dog flax and avocado oil. Olive oil and other oils that are rich in omega-3 and unsaturated fatty acids, and then saturated fats. I would recommend that you absolutely avoid excessive or trans fats. Among the meats you eat, there are some that are very inflammatory. Meat raised on grain or meat raised on caged, overly injured animals is better than meat raised on grain or caged, overly injured animals. There is talk that meat that is raised by running around in the environment and eating grass reduces the inflammatory response in our bodies. That's why, even if you eat meat that is rich in omega-3, which can reduce inflammation. Even if you eat one egg, I recommend eating it in a way that has a high omega-3 content, such as eating meat. And then I recommend limiting dairy products. If you continue to eat too much food and become obese, it is a problem even when it is excessive, but for example, alcoholic hepatitis and then cirrhosis of the liver. If you go like this, many problems will arise at the same time, including delayed liver cirrhosis. Cirrhosis is a condition in which the liver hardens and changes irreversibly, and the liver surface becomes irreversible. It means that the blood flow that is entering the lumpy area is blocked, and the liver can no longer function and hardens. As the blood flow is reduced, the blood vessels are under pressure, causing varicose veins to form and the blood vessels around the esophagus to swell. Problems such as swelling or hemorrhoids can occur, and blood vessels around the axilla can become enlarged. Albumin do not generate liver cells, all of which are damaged, and complications such as ascites or cirrhosis may occur. As various complications arise, the incidence of liver cancer increases and other bad diseases occur in sequence. It can happen that the condition goes beyond the environment where treatment is possible. When you hear about fatty liver disease, I am now in a state where I can come back, so I must make up my mind to change from here. Everyone has fatty liver. I would like to tell you that it is not something to be taken lightly. There is no one among modern people who does not have fatty liver disease. Non-alcoholic fatty liver disease is caused by hepatitis. There are things like fatty liver and such, but other than that, the fat caused by food is the biggest problem. continuing to consume excessive carbohydrates, the liver continues to experience repeated microscopic inflammation due to changes in carbohydrates that occur as simple sugars. If you come in, you will pass the liver inflammation and become a non-alcoholic fatty liver disease. There are many, and then excessive fat is also a problem. Fat is divided into several types: saturated fat, unsaturated fat. Fat is divided into trans fat, but among animal fats, saturated fat is consumed excessively. Among unsaturated fats, if there is a lot of omega-3 unsaturated fat, it actually cleans the blood vessels. It has the effect of reducing chronic inflammation, but in addition, trans fats are very inflammatory in the blood vessels in the body. Trans fat is a fat that causes a lot of problems. It is vegetable fat, but in order to make it easier to manage, it is a fat that has been hardened by the addition of hydrogen. What is the difference between saturated fat and unsaturated fat? It is a fat that has been hardened by the addition of hydrogen. The difference is that fat doesn't harden, but trans fat is vegetable fat. It is a hardened fat. So, what effect will it have when it enters our body? It is a little bit lower than our room temperature. It is maintained in a hardened state at high body temperature, so it has a negative effect on the blood vessels, causing inflammation and blocking the blood vessels. And you should avoid excessive saturated fats and trans fats. These trans fats are represented by sweets. Trans fats should be avoided as much as possible, whether they are used in food or fast food restaurants. To do this, there is talk again about avoiding processed foods. In Korea, it is said that we should avoid processed foods to maintain liver health. Habit first, I think we should talk about drinking before eating. Regardless of whether you are young or old, drinking culture is because it is widespread in people. It is important to keep the liver healthy and to prevent microscopic inflammation. To avoid wind substances, I have to avoid my body at company dinners. When I eat out, I eat food that is too high in calories. You can think of it as adding up all the things that you have denied your body, because the meat you have burned and the alcohol are not going away. And of course, alcohol, some people say that if you eat it, you will smoke again, so they will want to smoke again. Alcohol, cigarettes, and meat that burn excessive calories are the best. You have no choice but to avoid bad things, so for your liver health, stay away from company dinners and focus on exercise and leisure activities. I would like to recommend gathering like this in the center. Second, the habit of emptying, including intermittent fasting. I would like to recommend you to develop the habit of fasting and chewing your food thoroughly more than 100 times. I also need to get into the habit of chewing and eating for about an hour, but I think this is really difficult. I'm doing it on purpose now. When patients eat together, turn the hourglass and let the yogurt sit until the 30-minute hourglass is full. Practice eating slowly. I say this, but it's hard to make it a habit. But it's definitely comfortable. It is very important to have the habit of chewing your food slowly and thoroughly while breathing comfortably. Make sure you have enough time to eat. I would like to tell you to eat slowly, at least 30 minutes or as much as possible, and the third is to eat regularly. Exercise would be a good way to burn calories. Fasting is also very important, but it is also important to reduce blood sugar peaks after meals. I exercise to avoid that. So now, when I work at the hospital, I take the stairs after I finish eating. I go up and down to the 8th floor and do it 3 times. Even just doing that makes me sweat and get enough exercise. You may feel a stiff feeling in your legs, but if you work in an office or something like that, there are stairs nearby. Otherwise, if you have time after your meal, I recommend walking around for exercise. Another good thing is that instead of walking very smoothly and slowly, you have to walk fast enough to sweat. I recommend the stairs because the way to do it quickly is the stairs song. In fact, whatever. The thing about nutritional supplements is that you have to follow these things, but I don't follow these things. You shouldn't be mistaken that it's okay to take nutritional supplements. The most important thing is to quit drinking and then talk about liver health. You need to exclude it from your surroundings to maintain liver health. Then, fasting is the news, and then after meals exercise is the first thing to do, and then there are herbal medicines such as shoulder tree extract, but for patients with epilepsy, the basic medication used is ursodeoxycholic acid, which facilitates the discharge of bile. It is a drug that facilitates the discharge of bile. There is a method to use such medications, and this can also be used as a general drug. For instance, a 100 mg dose is commonly known as Urusa. You can live with it, and then there is also an extract medicine known as Silymarin. But the most important thing is lifestyle. I want to make it clear that improving the water supply is a priority, and that the blood vessels are not completely blocked. 3 premonitory symptoms of myocardial infarction that always appear in the body. Myocardial infarction is a symptom that appears when the heart blood vessels are completely blocked, so there are warning symptoms before it. In many cases, the heart is an organ that must beat without stopping to sustain life, and it suddenly becomes hypoxic. What happens if you fall and can't run? Your heart can stop within 4 minutes and you can die. So when a myocardial infarction occurs, I think you may not have a good sense of how many myocardial infarctions there are around us. There are surprisingly many cases where people collapse due to a complete blockage of blood vessels. In the past, I was taught to suspect renal infarction when there is chest pain in men over 40 and women over 50, but now the age is getting younger and younger, so I see neuropathy in my 30s once, and neuropathy in my 20s is very rare, but I do see it once. It has become a society where we see each other every time. The level of social isolation is increasing to that extent, and that story is that much of our blood vessels. I guess we live in an environment that is not in a very good condition, and it also changes a lot depending on the weather. For example, the tendency for vascular diseases to increase is higher when the weather suddenly becomes cold or when the weather changes from winter to spring. There are even days like this one. This morning, there are many diseases that are on the rise, such as myocardial infarction and cerebrovascular disease. It's a disease, so there are 7 people with cerebral infarction, cerebral hemorrhage, myocardial infarction, cerebral infarction, myocardial infarction, cerebral hemorrhage, myocardial infarction, myocardial infarction. There were days when I was brought to the 9:11 a.m. in a row, and it started at 6 in the morning. It was a myocardial infarction, which occurs when a heart blood vessel is completely blocked. Since it is a symptom, there are often warning symptoms before it, so I need to talk about angina pectoris. What is angina pectoris? If the coronary artery is narrowed by about 50%, the blood flow to the coronary artery behind it is blocked, resulting in an ischemic state. I'm talking about the pain that occurs when you lose weight, and it usually appears as chest pain that lasts less than a minute. So, it's like this. In this case, you should go to a cardiologist and get an X-ray to determine whether or not you have chest pain due to your heart or blood vessels. In some cases, there are also electrocardiograms or treadmill tests that are performed while running, such as echocardiograms or cardiac ultrasounds. These days, city technology has advanced so much that when you just take a picture of a plastic city or a cardiovascular city, you can see the cardiovascular system. There are also tests that confirm this. It is necessary to know the cardiovascular condition in advance. Here is more. If it progresses, it will lead to unstable angina, which occurs when the heart blood vessels are narrowed by more than 90%. It becomes so narrow that there is almost no blood flow to the back. In this case, chest pain occurs for more than 1 minute and within 5 minutes. It can be severe, and the emergency room is treating it as a myocardial infarction, so it is difficult to get the patient to come in. And we use drugs to prevent blood clots and prevent further blockage of blood vessels. And we also use drugs to dilate blood vessels through intravenous fluids. Please be aware that it is a dangerous condition to the point where you can mix and match. If it progresses further, the blood vessels will be completely blocked. When a blood clot is blocked, it is called a myocardial infarction. It occurs when a blood clot comes from somewhere and blocks a blood vessel in the heart. It blocks the narrowed area, or it is called a plug in the narrowed area of the heart blood vessel. We are talking about a state where a part is completely blocked by a rupture. In this case, the blood flow behind it is completely lost. It is characterized by severe chest pain as the heart muscle becomes completely hypoxic. The heart must beat without stopping. If this organ, which maintains our blood flow and life, suddenly falls into hypoxia and cannot run, what happens? Within 4 minutes, the heart can stop and death can occur. So when a myocardial infarction occurs, you should immediately call 911 to get help, but those around you should not touch the chest of a patient who has collapsed. When a patient is grabbed and falls like this, rush over and check their consciousness. If they are unconscious, then resuscitate them. We need help in society, such as calling 911 quickly, reporting the incident, and giving CPR. It can be seen that something like that is needed to do those things. It is the most ambiguous symptom of myocardial infarction. If you have chest pain, you should immediately suspect a heart problem and get an electrocardiogram first, but that's no, about 15% of the people are complaining about the pain. They are complaining about the pain. If you can't make the connection between chest pain and stomach problems, and think about problems in the stomach, you may have heart disease. There are times when you might miss something, so it is important to take an electrocardiogram and check it when you change your uniform. It is very important to take it as a principle. From the patient's perspective, it is not chest pain, but just a feeling of discomfort. If you think that the pain in your upper abdomen is not an urgent heart problem, you may postpone reporting it or visiting the hospital. It is a problem, so from the patient's point of view, even when the patient is in the upper abdomen, there may be sudden, unexplained cold sweats. If the pain is severe, do not leave it alone. Think that it may be a heart problem and go to the emergency room. It's important to think about getting help. What if you miss the situation and go to the emergency room and get an EKG? Fortunately, there was no death due to myocardial infarction in a state where acute myocardial infarction had occurred 2 to 3 days ago. We often see cases where people arrive at the emergency room, and by the time they arrive at the emergency room, it is already too late and they are in heart failure. We often see cases where the elderly have complications and need treatment. In the case of the elderly, they do not feel pain properly. Some people may not feel chest pain properly if they are not able to do so or have long-term diabetes. In such cases, it is not chest pain. There are cases where people come to the emergency room with symptoms such as just feeling tired and not eating well, or they are elderly people with dementia. It can happen even if you are unable to properly express your condition or are just lying in a coma. And in these cases, the medical staff also say that it is not chest pain, but heart disease. There may be unexpected cases, such as when cardiac enzyme levels rise during a blood test and are only then confirmed. There are also cases where there are elderly people at home or people with poor blood vessels, such as those with high blood pressure or diabetes. If you are old or have chest pain and suddenly have trouble eating or complain of feeling weak, in the case of some people, they may have suspected at least once that it might be a disease caused by heart disease and performed a blood test. It is important to try it. If you miss that time, if you miss the early treatment period, you will naturally end up with heart failure. It happens that the heart cannot pump properly. If this happens, you may suddenly have trouble breathing. There are also cases where patients come to the hospital for emergency checkup as a result of edema of the limbs or after renal infarction. In the case of heart disease, the most common symptom is chest pain, so patients feel chest pain and visit the hospital. This is the most common case, but other than that, people come in with leg swelling or arm swelling after heart disease. There are cases where the patient comes in with a post-myocardial condition and heart failure, so the symptoms of limbs sticking together occur. When you have difficulty breathing or have a heart attack, you should definitely consider heart disease and come to the hospital. In addition, when your blood vessels are not in good condition, other diseases include cerebrovascular disease, which causes slurred speech or dizziness and vomiting called dysphagia because when a stroke occurs on the damaged side, dizziness can occur. When these things occur, there may be a vascular disease. You should think about whether it is a vascular disease or not. In rare cases, it is a vascular disease such as intestinal infarction, and the stomach suddenly swells. I feel like I have strange diarrhea or my stomach feels bloated. There may be cases where symptoms appear, but in these cases, it is rare that they appear due to vascular disease. There are a number of cardiovascular diseases such as myocardial infarction. In this case, the golden time is considered to be within 1 hour. Of course, now, treatment is possible even within 2 hours or 3 years. There are cases where the procedure cannot be performed if the heart blood vessel has been blocked for a long time, up to 6 hours or more. When it passes, it is not measured because when the blood vessel ruptures while penetrating the heart blood vessel, blood accumulates around the heart. It can be a very emergency situation because it can cause the heart to stop beating and can lead to immediate death. So, it should be set not to count after 6 hours or more. That's why it should be set not to count after 1 hour. However, you must come within 3 hours at the latest to be able to do a cardiovascular tree. The same goes for cerebrovascular disease. If you come within 3 hours, you can do a cerebrovascular tree, but if it has been more than 6 hours, you can do a cerebrovascular tree around the cerebral blood vessels. Since the existing tissues may already be necrotic, they may penetrate the cerebral blood vessels and cause cerebral hemorrhage. Because he has had a cerebral infarction and cerebral hemorrhage, he is in a state where he cannot lower his blood pressure or raise it. Because of this problem, treatment is carried out by observing the golden time, and sometimes in cases such as cerebrovascular treatment, depending on the procedure, there are cases where the procedure can last up to 12 hours. It's not that I don't go to the hospital because it's late for the golden hour. I go to the emergency center and get tested and check my condition. Whether or not to perform the procedure should be decided based on the patient's condition. When a myocardial infarction occurs, there is no way to do it. Rather, the people around me need to help me. It is right to receive help from the 911 situation room in this state, and it is right to receive help from the situation room in this crowded situation. Since everyone has their cell phones, you can turn on speakerphone with your smartphone or use video calling to help. You can receive it, so you need to ask for help from people around you. First, if you know that you have angina or unstable angina or have had a previous myocardial infarction, for example, if you have ever had a stroke or heard during a health checkup that your blood vessels are in poor condition, I heard that the carotid artery was very thickened in the carotid ultrasound. These people are now becoming members of the U.S. hospital. That's because it was confirmed that the blood vessel condition was not good, and other than that, if you have suffered from cerebral infarction or stroke, people who have had high blood pressure or diabetes for a long time and are thought to have poor blood vessels should be especially careful about their lifestyle. Correct your habits and then find out where to seek treatment when an emergency arises. I need to know if I can get it in my living area. Then, there is now a vascular center. We have a surgical team that can open the cardiovascular and cerebral blood vessels 24 hours a day. We're talking about hospitals, but usually, each region has an emergency medical center, or regional emergency medical center, or something like that. This kind of procedure is performed at an emergency medical center level, so which hospital among emergency rooms can perform this kind of procedure? I found out in advance that if I suddenly had an acute cardiovascular symptom, if you hear something, you may experience severe chest pain that feels like an elephant stepping on you for more than 5 minutes, or symptoms of paralysis on one side of your body. When symptoms of cerebrovascular disease such as hearing loss or speech appear, go to a hospital that can perform cardiovascular and cerebrovascular procedures. You need help like this, such as moving quickly by taking a one-day train or moving quickly if it's close by. Yes, but in fact, it is impossible for the general public to know all these things, so that is why there is a 911 system. What do 911 personnel do? We are trying to figure out what kind of treatment is available at the hospital, so it is better to report it quickly to 911. It might be important for me to quickly let 911 know that I am in this condition rather than trying to solve it on my own. I recommend that you register and get help so that I can find out what my body condition is and what disease group I have. It is important to know in advance whether it is dangerous and to evaluate and understand it yourself. Regular health checkups. It is very important to first take an electrocardiogram to check the condition of the cardiovascular system. If angina is detected on the electrocardiogram, there are cases where traces like this are found that are from a while ago. That means that the heart blood vessels are severely narrowed. There may be evidence of this, and other arrhythmias are also found. In this case, blood clots may occur. Such drug treatment to prevent or reverse arrhythmia. There are cases where it is necessary to do so, and there are also cases where the blood vessels need to be widened through a procedure. That is why it is necessary to dilate the blood vessels. Electrocardiogram examination is very important in the examination, and in addition, important diseases related to vascular health are hypertension, diabetes, and hyperlipidemia. Patients with this disease need to have regular health checkups to check their vascular health. We regularly take carotid ultrasound, electrocardiogram, and other things to know in advance what the condition of the blood vessels is. It is important and to check the condition of the brain blood vessels, but it does not include electric field examination. Among MRIs, there are tests that take things like diffusion. These are also done by a doctor or someone like that. If you suspect that you have symptoms, I recommend that you get a diagnosis and undergo tests from a medical professional. If not, then if you delay or do something like that despite needing to get tested, it can lead to a dangerous situation, so we recommend the Neurology and Cerebrovascular Center. Or, if you have been recommended to undergo a test by a cardiologist or similar department, I recommend that you actively undergo the test. The 3 best foods to prevent pancreatic cancer. The number 1 cancer mortality rate. The 1-year survival rate for this condition is less than 5%, and because it is surrounded by other organs, there are almost no visible symptoms in the early stages, making early diagnosis extremely difficult. This makes diagnosis particularly challenging. These foods not only contribute to the longest survival rates, but are also linked to many of the cancers that have been on the rise in our country recently. They cause chronic inflammation and can lead to heart disease, arthritis, diabetes, and cancer. The first food that contributes to the longest duration of immune-related diseases and other conditions is often processed foods. Additionally, reducing the side effects of modern standard treatments and improving them is an area of great interest. For the most severe cases, the 5-year survival rate after surgery is just 14.3%, and for all types of cancer, the survival rate for cancers that progress to later stages is less than 5%. This is because many cancers are not detected until they have already advanced. Even when surgical resection is possible upon discovery, the survival rate is still under 20%, and if the cancer is visible to the naked eye, there is still a very low chance of survival with only surgery. Additionally, the survival rate does not improve significantly even with microscopic surgery, chemotherapy, or pyogenic treatments, because the response to these treatments is low. The pancreas is located behind the stomach and other organs in the retroperitoneal cavity, which makes it difficult to detect early. Symptoms typically don't appear until the 40s, and by then, in about 50% of cases, it has already progressed to an advanced stage. Even when symptoms do appear, they tend to be common digestive symptoms like abdominal pain, sluggishness, weight loss, and jaundice, but they can vary depending on the tumor's location and size. For example, patients with cholangiocarcinoma often experience abdominal pain and weight loss, while those with tumors in the pancreas may experience jaundice. The most common factors that increase the risk of developing pancreatic cancer include being over 45 years old, having a pale complexion, a family history of cancer, diabetes, obesity, and a diet high in fat. Recent studies show that chronic pancreatitis and some genetic factors are also significant contributors to pancreatic cancer. In fact, 5 to 10% of pancreatic cancers are genetically inherited. However, even without a family history of the disease, those with a history of cancer in the affected area have a higher risk, about 1.5 times higher than those without a family history. The primary foods that contribute to the development of this cancer are fried carbohydrates. What comes to mind first? Yes, French fries, followed by donuts and most other sweets and snacks. These are all fried carbohydrates, which continuously burden the pancreas and promote inflammation. Chronic inflammation is a key factor in the development of pancreatic cancer. Another significant contributor is fatty meats, such as pork, which is rich in saturated fats. Red meat, in general, has similar effects, especially meats that contain a lot of marbled fat, which is often considered desirable in Korean cuisine. This high fat content strains the body over time. Processed meats like ham, bacon, and sausages are also major contributors to health problems. These foods can cause a variety of long-term health issues, and it is essential to be mindful of their consumption to reduce the risk of developing serious diseases, including pancreatic cancer. It is well known that red meats and processed meats have some of the longest-lasting negative effects on health, and these are classified as carcinogenic substances. The third major contributor to health problems is alcohol. Alcohol can lead to pancreatitis, especially in combination with gallstones, and is a known major cause of inflammation in the pancreas. This inflammation disrupts the pancreas' ability to secrete digestive enzymes, leading to malfunctions that can cause the body's own tissues to break down. Furthermore, when alcohol raises body temperature, it facilitates the spread of internal inflammation, making conditions like pancreatitis worse, particularly for individuals with a family history of the disease. It is considered a mistake to consume alcohol if you have a predisposition to pancreatitis. Similarly, consuming animal fats, particularly from red meat, negatively impacts the pancreas. The pancreas is forced to work harder to store fat, which can lead to cell damage over time. Among young people today, high-fat foods like beef intestines, pork ribs, and deep-fried snacks like rice cakes, which are increasingly popular, are high in saturated fat and can put significant strain on the pancreas. Foods high in fat and sugar should be avoided, as they can cause the pancreas to work overtime. When you eat foods high in fructose, such as energy drinks or sweetened juices, insulin sensitivity can decrease, and fructose itself can lead to advanced glycation end products, which cause inflammation and oxidative stress. This can damage tissues and organs over time. For overall health, it's best to avoid foods with high levels of fat, such as French fries and ice cream. These foods, as well as red meats, processed meats, sugary snacks, and fried foods, contribute to chronic inflammation, which can lead to heart disease, arthritis, diabetes, and immune system dysfunction. Even though fructose is naturally found in fruits, today's processed foods often include artificially added liquid fructose, which creates advanced glycation end products. This contributes to inflammation and damage by attaching to blood vessels and organs, leading to various diseases. If left untreated, this inflammation can progress and result in severe health complications. Foods like French fries, donuts, cookies, and snacks are full of unhealthy carbohydrates and fats. These foods put a strain on the digestive system, potentially causing inflammation in the intestines, which may eventually lead to colorectal cancer. It is crucial to focus on a diet rich in green and yellow vegetables, which are high in fiber and plant-based nutrients. These vegetables support long-term health and are especially beneficial for preventing overeating and helping with fasting. A balanced diet, along with good eating habits, can significantly impact insulin sensitivity. Additionally, it is important to chew food thoroughly to support digestion. Antioxidants play a key role in reducing inflammation, and omega-3 fatty acids are helpful in this regard. Taking digestive enzymes daily can further reduce the burden on the digestive system. Cruciferous vegetables like cabbage, broccoli, and kale are excellent choices. Cabbage, which is easily available, contains indole 3-carbinol, sulforaphane, luteolin, vitamin U, vitamin K, and more, all of which have anti-inflammatory and anti-cancer properties. Garlic and green onions, from the allium family, are rich in antioxidants and play an important role in preventing and treating chronic diseases. Garlic, in particular, contains anti-cancer compounds such as allicin and sulfur compounds, which are even more effective when cooked rather than eaten raw. Capsaicin, found in chili peppers, is also beneficial, as it can cause pancreatic cancer cells to self-destruct. Spinach is another powerful food, containing flavonoids like quercetin and campesterol, which help prevent cancer and have anti-inflammatory effects. However, to retain the full benefits of these nutrients, it is important not to overcook spinach, as prolonged boiling can destroy some of its effective compounds. Eating strawberries is a great choice for improving health, as research suggests that the folic acid they contain may reduce the risk of developing breast cancer. Strawberries, along with other fruits and vegetables, can play an important role in cancer prevention. However, it's important to note that not all parts of food are equally beneficial. While some components like the leaves of certain plants can be helpful in preventing cancer, supplements made from these leaves don't provide the same benefits. This highlights the importance of consuming food in its natural form, rather than relying on processed supplements. When it comes to preparing food, many people opt to fry foods to achieve that crispy, golden texture, but this method can strip food of its nutritional value. Instead of frying, consider using an air fryer, which can produce similar textures with far less oil. If you do need to use oil in your cooking, make sure to choose healthier options like olive oil or safflower oil, which are rich in unsaturated fats. It's also important to use oil sparingly, ideally drizzling it on food after cooking rather than heating it in the pan. A crucial point to consider when adjusting your diet is to avoid sugar and fructose. These ingredients can have negative effects on the body, and excess consumption can lead to various health issues, including an increased risk of obesity, diabetes, and heart disease. If you're having trouble cutting out sugar, consider replacing it with artificial sweeteners or other sugar alternatives. However, it's important to keep in mind that while these alternatives might help reduce sugar intake, they should still be consumed in moderation. In terms of overall dietary habits, it's best to avoid processed and overly refined foods. Aim to consume food as close to its natural state as possible, which provides the most nutritional benefits. Vegetables should be consumed in their raw or minimally processed form, with an emphasis on variety. Different colored vegetables and different parts of plants provide a broad range of essential nutrients, so make sure to incorporate a diverse selection into your meals for a balanced diet. Animal fats, particularly from red meats, should be limited, as they are known to contribute to a range of health problems, including heart disease and cancer. Additionally, foods high in fat and sugar, such as French fries, donuts, energy drinks, and other processed snacks, can also cause long-term damage to your body. These foods promote inflammation, disrupt normal bodily functions, and put extra strain on vital organs like the pancreas. Instead of consuming these foods, focus on eating plenty of vegetables, which are rich in fiber and help regulate digestion. Fiber is especially important because it helps the body absorb nutrients more efficiently and reduces the absorption of unhealthy fats, sugars, and cholesterol. Foods that are high in fiber, such as leafy greens, legumes, and whole grains, should be a regular part of your diet. These foods can also help regulate blood sugar levels, improving insulin sensitivity and lowering the risk of metabolic diseases. When it comes to beverages, it's crucial to avoid sugary soft drinks, as they are loaded with fructose, which can cause inflammation and damage to blood vessels and organs over time. Instead, opt for water, herbal teas, or natural fruit juices that are free of added sugars. Drinking plenty of water throughout the day helps keep your body hydrated and supports optimal digestion. Additionally, consider incorporating more fruits, vegetables, seaweed, and brown rice into your meals. Brown rice is an excellent source of fiber and nutrients and can serve as a healthier staple food in place of refined grains. Limiting meat consumption, particularly red meat and processed meats, is also important for long-term health. While it's okay to enjoy meat in moderation, it's best to choose lean cuts and prepare them using healthier cooking methods. Grilling, roasting, or steaming meat are healthier alternatives to frying. Raw vegetables and steamed foods are excellent options for maintaining a nutrient-dense diet. Making dietary changes may feel overwhelming at first, but don't be afraid to take small steps. Gradually adjusting your eating habits can have a profound impact on your health. Focus on one change at a time, and over time, you'll see improvements in your overall well-being. It's not about achieving perfection overnight, it's about making consistent, mindful choices that will help you feel better and reduce your risk of chronic diseases. Start by incorporating more whole foods, like vegetables and fruits, into your diet, and focus on reducing processed and sugary foods. Little by little, these changes will lead to a healthier lifestyle.